We've had a really rich hour of conversation, so I wanted to give everyone an opportunity to wrap up with some closing remarks. We've had some real roller coasters of some real lows in some of the challenges, and I wonder about, as we think ahead, what your closing remarks and what you see as looking ahead to the future. We'll go in the same order. So Madeline, I wanted to start with you.
Sure. Ilana, I wonder if I can touch on something you asked before when I deferred to Jennifer, and I did realize something that I want to mention about a kind of ray of light that in previous vaccine ceasefire rollouts.
I'll make an exception for a ray of light.
Okay, and in humanitarian efforts generally. One thing I learned in reporting this piece was the really essential role of local women's groups and women's activists, feminist activists. This is something that I think tends to be ignored, but the academic literature that has looked at these negotiations has found again and again that when women are involved in negotiating these pauses or ceasefires, they're much more successful, they're much more durable. Women have just these fantastically rich networks on the ground. And, in my piece, among other things, I quote, I spoke with a Syrian feminist health activist who said that her little local group was able to negotiate a humanitarian pause in a besieged Syrian town. Just because, very often local women are perceived as non-political in a way, not non-self-aggrandizing. Their motives are considered more pure or good. So I just want to mention that. But just generally, what I've discovered in my reporting, this discussion can really lead you to despair, is that humanitarian groups, is Esperanza, Jennifer, Claude have all mentioned, they have perfected the art of engaging with local communities. They have done this for decades. This is what they do. And the problem in 2021 and probably according to projections, 2022 and even 2023, is that the vaccines are not available to back up their good intentions and their expertise. So in many places, even despite these formidable obstacles that people have talked about, they're primed to roll out vaccine campaigns, but because of the vaccine shortage, they're hamstrung.
Thank you, Madeline. Madeline Drexler, journalist. Esperanza Martinez, I wonder if you would provide some closing remarks as well.
Yes, thank you. I think that we need to see COVID-19 really as showing us how many glaring inequalities we have in access to healthcare worldwide. It's not only developed countries versus countries that are poor, but it's also within countries. There are segments of population that really don't have access to healthcare. So I think it is, when we look at armed conflict, I think we no longer can argue that we do have a world in which you have humanitarian crisis, dealt with humanitarian aid, and development post-crisis. There is no post-crisis. We are in the middle of the crisis. So I think it's an opportunity, as Claude mentioned, not only to rethink what equity means in terms of vaccines, but also to think how we handle globally humanitarian crisis today, how we need to invest in strengthening and supporting and often building from scratch health systems that are more equitable, that are able to really guarantee access for populations in an impartial and neutral manner.
Thank you for that. Claude Broderlein, I wanted to give you a chance to provide some closing remarks as well.
With great pleasure. Well, what I can tell you here, we're teaching the next generation of global health professionals at the School of Public Health here at Harvard. And that's the message we send. If we're able to tackle this global pandemic, we are now equipped to tackle with other global challenges, including migration, including climate change. the fundamentals of tackling global challenges is with us. We have the tools, we have the methods. Now we need the policies and the political will to move forward. And I think COVID-19 is an opportunity to line up these thoughts and efforts and to get going, because we're going to have these global challenges coming at us for the decades to come, and it's time to start.
An opportunity. Jennifer.
Yes, thank you. I agree with previous speakers in this wrap up. I would say that my focus is currently on healthcare and public health. And in these remarks, I believe that the division of the world into humanitarian zones and zones at peace and stability is obsolete. The world is changing very quickly and in many ways deteriorating. And the necessity for those who do the high level plans and develop the systems and priorities to talk with people who are actually at the level of doing healthcare and delivering healthcare could never be more urgent, because what you have is an example. I mean, we began with the Secretary General saying something lofty, and then it's gotten lost in the wind. And with the turmoil of all the complexity of the COVID-19 crisis, but then the other crises that are beginning to blend with it. So from my perspective, we need to be requiring our national and global leaders to be thinking about the last mile problem. What are they doing in terms of systems and policies that will make it easier for healthcare workers and other kinds of humanitarian workers to do their jobs in situations that are affected by conflict, but also in situations that are increasingly affected by forced migration and climate change?
There's so much looking ahead to be thinking about, as all of you have unpacked today. Thank you so much to all of the panelists here for providing so much important insight into what's happening.